Many of the communities that Whittier serves face barriers to healthcare access, impacting their ability to prioritize health and leading to significant disparities in health outcomes.
With the move to a new building in 2012, we now have the capacity that complements our ability to champion equitable access to high-quality health care. We have launched a bold 5-year plan through our Boston Health Equity Project. With this plan, we will double the number of people served by 2017, improve key health indicators, and address the disparities associated with race, ethnicity, income, and the environment in the communities that have had the heaviest burden of health problems.
In a state where nearly everyone has health insurance, Whittier's patient population is 35% uninsured.
What we've learned and what we know is that having an insurance card alone, that's not enough. We need to make sure that patients have a whole array of services to make sure they get the care they need. That's where the Whittier Street Health Center comes in.
Whittier offers over 40 health and social services, connecting patients to primary care, wellness and prevention, and specialty clinics, empowering them to become advocates of their own health.
The idea of the medical home was actually started especially for primary care to help patients essentially get a better experience with accessing health care. To have one team, a multidisciplinary team, sort of helping them navigate the medical system. It improves access to care, it improves, patient satisfaction, and it helps with coordination of care.
At Whittier Street Health Center, we're working on integration of behavioral health into medical health. And it's really a very important initiative because so many people who come have reasons that they don't believe in mental health care, separate from their doctor visits.
For a lot of our patients, we have to realize that they can't really get well physically without being well mentally. And the fact that we have a mental health department here, I think really makes it easier.
Health ambassadors focus on community outreach as part of Whittier's unique healthcare delivery model.
We have a program here, partly funded through AstraZeneca, that allows us to go into the community with health ambassadors who are members of the community. They identify people in the community who may or may not have access to health care currently and may or may not have health insurance, and identify people with risk factors for cardiovascular disease.
The causes of racial and ethnic disparities in pediatric obesity are multifactorial. Through the childhood obesity programs at Whittier Street Health Center, a multidisciplinary team is working together to reduce these disparities by linking children to physical activity resources, nutrition education classes, increasing access to healthy foods, and enrolling kids in our after-school physical activity program.
To reduce cancer disparities in low-income and minority communities, Whittier has formed a partnership with the Dana-Farber Cancer Institute.
Patients that we see at Whittier Street come from a traditionally underserved community, and this community has been historically reluctant to seek care. Ultimately, the way we address these racial and ethnic disparities is by leveling the playing field and by making sure that patients from any background, they have the same access to the best possible cancer care as any other person in the state of Massachusetts or anywhere.
The American Cancer Society, and it talks to you about what is breast cancer. One of the goals of the Cancer Education Center is to provide a warm and inviting space for the patients, the staff, and the community to find cancer-related health information. To meet the needs of the diverse population that we serve in the greater Boston area, we offer culturally appropriate materials.
We were recently accredited by the NCQA as a golden level patient-centered medical home, which is their highest ranking. Being a patient-centered medical home means we take responsibility for the full array of our patients' care using a team-based approach. That is, delivering care for all stages in all ages of life, addressing the needs of the whole person focusing on wellness and prevention, chronic care, acute care, end-of-life issues, and assisting patients with care coordination for services offered at Whittier and services offered at our hospital partners, and also coordinating care with emergency room departments to reduce the unnecessary use of emergency room services.
With this integration of services, Whittier hopes to significantly improve the health of the community served and make a positive impact on the high cost of healthcare.
I always have to remind our patients that they're not sick only when they feel sick. You know, part of primary care is for them to seek care even when they feel well to prevent getting sick.
In the United States, there are about 500,000 preterm deliveries every year, and this costs us a lifetime cost of $26 billion over a lifetime. So if you can make a small impact on the rate of preterm delivery, it could have enormous benefits to our society.
Blue Cross Blue Shield of Massachusetts was founded 75 years ago on the principle that everyone in our community should have the same access to quality, affordable health care. Those have been our values since our founding. We look for community partners who share those values. Whittier Street provides care to people all over Greater Boston in their language, in a culturally sensitive way. Whittier Street not only provides medical care, provides social support, wellness, nutrition, outreach. That's the kind of care for the whole person. That's really the model for healthcare for the future.
We measure our performance and health improvements and know that the Boston Health Equity Project will have positive impact in the lives of our patients and serve as a model for innovative, cost-effective, results-driven, community-based healthcare.
The model of care that Whittier relies on to fulfill the promise of the Boston Health Equity cause is largely in place, and its potential for success is reflected in the growth of the center's patient population. However, further innovations will strengthen Whittier's capacity to improve community health on a much larger scale. With your support, Whittier will continue to offer its virtual clinics at public housing developments and in the community, launch its much-needed medical fitness center to expand its holistic care, advance medical record technologies, and foster strong partnerships with other medical centers and Boston public schools.